If you're an older adult and you've noticed some weakness in your grip strength or that you're dropping things, then you should be concerned. But fortunately, there are some things that you can do about it. Hi, I'm Dr. Dave Candy. I'm a specialist physical therapist who works with a lot of older adults. And I'm going to show you 4 things that you can do to help improve your grip strength. And surprisingly, not one of them is grip strengthening exercises. And I think this is really important to mention because there was a recent viral video about 4 grip strengthening exercises that seniors can use to improve their grip strength. And I won't name the creator out of respect to them, but it is important to know that grip strength in older adults is a well studied biomarker that goes much, much deeper into your overall health. And it's not reflective of just weakness in your wrist muscles or forearm muscles or hand muscles. So I do want to set the record straight that grip strength is a very common issue in older adults, but it's much more reflective of your overall health. And to back up such an audacious claim, I do want to go into a couple research articles that back that. The first one being about grip strength being an indispensable biomarker. And you can see from this article that it's reflective of overall strength, upper limb function, bone mineral density, fractures, falls, malnutrition, cognitive impairment, depression, sleep problems, diabetes, multimorbidity, and quality of life. And just squeezing a towel is not going to do anything to improve those things. So, this is an effect where treating the grip strength problem is really treating the symptom rather than the underlying root causes. Now, you can see from this next article here that the role of gait speed and grip strength predicting 10-year cognitive decline in community dwelling older people. The conclusion of that was basically that both of those are predictive of cognitive decline. So if you walk slower, you have a weaker grip, you are going to, where was the conclusion here? So you can actually see that I'm not making this up. Conclusions. Both of those things, if you walk slower or have weaker grip strength, you're more likely to have cognitive decline as you age. Going into the next article, factors that determine grip strength in older adults. Now, interestingly, these are different between men and women, and this is a very well-studied thing in older adults. If you look at the people that are in this, this was 849 people aged 55 to 88. They were part of a twin and adoption study, so they've been studied basically their entire life. There was a 22-year follow-up period, and they started measuring risk factors 20 years before they even started measuring grip strength. So this is a very, very, very strong article as research goes. And the things that they found that affected grip strength in women were stress, smoking, and dementia. And for men, marital status, mean arterial pressure, which is like the average of your top and bottom numbers, physical activity at work, and having a chronic disorder. So you can see this is much more predictive of overall health. And those are the things that really affect the grip strength much more than just weak wrist and forearm and hand muscles. Another article, factors associated with low hand grip strength in men and women were low body weight, low weight, and anemia, so having not enough iron in your blood. And then for men, diabetes was an important risk factor. So the first tip is actually just diet, making sure you're getting enough iron in your diet, making sure you're keeping your sugars under control, that you're keeping your weight at a healthy level. Those are very important things, along with you can see that smokers or former smokers are at risk. So not smoking is very important if you want to improve your hand grip strength. Both of those, the diabetes and smoking, are important when you consider that one of the biggest causes of weakness in your hand grip is impairment of the nerves, particularly the median nerve at the carpal tunnel, which we'll get into a little bit later in this video. But if you have weak grip strength, it's probably more a neurological and metabolic disorder rather than just a musculoskeletal problem. And people who either smoke or have high blood sugar or diabetes are much more likely to have nerve problems than people who don't do those things. Additionally, poor health assessments, so people who self-rate their overall health over the past 12 months as being less are more likely to have hand grip problems. Okay, so now I mentioned we would get into carpal tunnel syndrome. So just in case you don't know, the carpal tunnel is a little area in your wrist. It's made up of the bones and a little ligament that goes over top of it. And the median nerve into these first three fingers is affected in hand grip strength. So if you have a pinched median nerve at your wrist, that's going to compress the nerve that supplies the muscles in your hand. And no matter how many times you squeeze a towel or do grip strengthening exercises, if the nerve is being pinched in your hand, then you're not going to get any stronger because the signal is not getting from your brain to your muscles, telling the muscles in your hand or in your forearm to work and help make you stronger. So it is important to make sure you check for carpal tunnel syndrome and make sure you have adequate mobility in your wrist and in the carpal bones. And I'll link to another video that goes through exercises for carpal tunnel syndrome. But that is an important thing, and that's another tip. If you are having grip weakness, to assess and treat properly for carpal tunnel syndrome. And check the end screen at the end of this video or the links down in the description. I'll link to those other videos that I mentioned in this video. So in older adults, they found that there are no age differences in subjective complaints in carpal tunnel syndrome, meaning that it may not be any more pain or any more complaints about dropping things or such, but older adults had more highly compressed nerves or neurological findings when they do electrical testing of their nerves. So it is more common for older adults because of arthritis and other things that develop at the wrist to develop more severe compression of the median nerve, which again can result in hand weakness or grip strength problems or dropping things. So now we're going to go on to exercises. I mentioned that doing grip strength exercises is probably an enormous waste of your time if you have grip weakness. And again, that's because it's really treating the symptom rather than the problem. This is a study that measured hand grip strength. A meta-analysis is the strongest level of research. It's basically taking lots of different research studies, assessing them for quality, and then pooling the findings of all of those studies. So whenever you see something that says meta-analysis, it means that's a really, really good study. And the effects of these, their conclusions are small but meaningful transfer effects of a multiple different exercise training and hand grip approaches occurred in community dwelling older adults. Now, essentially, what that means is that the effects of any exercise training were pretty small. The things that they found were most helpful were task specific and multimodal training programs. So that means things that are specific to the activities that you do in everyday life or things that incorporated a lot of different types of exercise. For example, aerobic exercise and strength training, not just doing, say, grip strength exercises. So these are more overall exercise programs, and things that addressed more than one component tended to work a little bit better and result in better grip strength. And when you consider again that grip strength is a marker of overall health, not just musculoskeletal problems, it makes sense that when you do cardiovascular exercise to help your blood flow and your cardiovascular system, to get more oxygen to your system, as well as strength training. And these can be any strength training exercises because anytime you do, say, a bicep curl or a lat pull down or a bench press or pretty much any type of upper body exercise, you've got to hold on to something. So you're strengthening your grip while you're training other things. And that's why isolated grip strengthening exercises, such as just squeezing a towel or squeezing a stress ball, are more or less a waste of the time because anytime you train your upper body with weights, then you're going to be strengthening your grip anyway. So to summarize what we've talked about so far, we talked about getting proper diet and weight management, not smoking, assessing for carpal tunnel syndrome, and having an overall good exercise program. Now, I do want to mention one other thing that can affect your grip strength, and that is also another pinched nerve problem, but not at your wrist or your carpal tunnel, but actually at your neck. As you start to develop arthritis in your spine as you age, for example, degenerative disc disease or spinal stenosis, you're more likely to pinch the nerves in your neck, and the C7, C8, and T1 nerves are the nerves that make up the median nerve that go down to your wrist. In a lot of people who have carpal tunnel syndrome, particularly in people who have carpal tunnel syndrome in both hands, there's some involvement at the neck where the nerve roots actually come out, the nerve roots that make up the median nerve. And so if you are having hand weakness problems, even if you've been tested for carpal tunnel syndrome and they've found that you do in fact have carpal tunnel syndrome, it's a good idea to get your neck checked out too, to make sure that there's not more than one problem contributing to your hand weakness. And so I do have another video about spinal stenosis in the neck and some tips that you can use to, one, help decide if you might have that, and number two, some things that you can do to help out if you think you might have spinal stenosis or pinched nerves in your neck. But before I send you over to those videos about carpal tunnel syndrome and the pinched nerves in your neck, if you did find this video helpful, then make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.